Hello, Made to Thrive Nation. We've got a very special guest who sits on the scientific advisory board of Made to Thrive. He's been on the show twice, so he's a third-time visitor, and he's become a friend. And he's someone I look to for, not only expert medical opinion and just who he is and his character, but someone who's really become someone out there in the community that's a pioneer, who's got courage, who's got an incredible calling. Excited that he's just got married and he's got a child coming on the way. So I really want to warmly welcome, and I've just invited him to come to Africa because it's such an incredible place. But welcome back, Dr. Leland Stillman.
Thank you for having me. It's a pleasure to be here.
Brilliant. Now, so I'm going to ask you this opening question about what's really exciting you with regards to medical health or just the holistic field of, integrative medicine or functional medicine. You've been around for a long time. Leland is a medical doctor. He specializes in internal medicine. He's board certified in internal medicine. And he's got some incredible means like light shaping life. And so I've learned a lot from Leland over the years. But what's really on the horizon for you, or what are you exploring right now that's really exciting for the future of people's health and wellness?
So I think the most exciting thing for me right now and what I'm doing is really integrating what I've learned and what's out there. You don't have to go very far in the integrative natural functional medicine space to see all these different protocols and this protocol, that protocol. But I find that a lot of people coming to see me have already listened to all the podcasts, read all the articles, tried a lot of protocols, and they haven't found success. And trying to come up with not only what are they missing, what did they need to do that wasn't, uncovered by past clinicians they've seen or protocols they've tried or articles they've read, blog posts they've listened to, what's the gap in their knowledge or their daily choices that's leaving them feeling like they're not getting results. But then also, where should we start anyone, whether they're a veteran biohacker or a complete newbie who's just decided to take charge of their health? Where do we start them? And then what are the most fundamental things for them to do? And how do you put that together really in a whole comprehensive program so that you don't, on the one hand, overwhelm them, which can often happen when people get into this space. But you also can accommodate those who have a higher bandwidth and can learn faster and implement faster. So that's what we're really doing in my medical practice. And it's a really exciting time. I last time I think we spoke, it was pretty much just me on my team. And now I have a health coach, strength and conditioning coach, Jim Laird, runs our health coaching department. And, we've got an amazing nurse, Eva. My wife is one of our nurses, although she's now transitioning into more of an office manager role. And then we've got an amazing coach named Amy, and I've got an amazing nurse practitioner named Lauren. So we have the ability now to, have, medication management as well as advanced supplementation protocols, as well as everything from strength and conditioning training to health coaching all under one roof. And that's what's most exciting to me is that I feel like, particularly my journey, I went from mentor to mentor, saw how different people did things, and didn't feel like there was a comprehensive framework that really served people and put people first. A lot of the times it was incomplete. It was not as effective as I'd hoped it would be. It was too expensive. It was unsustainable. And so I just sort of grew disillusioned with one mentor after another in terms of their approach, and that's why I started my own practice and why now I've built this team to do what we do. We actually have patients as far away as South Africa, and we've got patients here in the United States from Washington to Maine to Florida to California. So we see everyone everywhere. We've got even a patient in Mexico, and we've got a couple people in Europe too.
Wow. Sounds
Yes,
exciting, and also that's
it
what happened
is.
in my practice and COVID. We were patients in Austin, Texas, to Singapore, to Scandinavian countries, to Australia. So, yeah, and
Yes,
using a lot of health coaching because I believe there's a huge chasm between physician and patient, and that health coach is crucially important to help sustainably help people transform. And I think that's the key: is what is sustainable, what is not. And I think health coaching is going to grow. So it's nice to see that you've done the same.
absolutely. It's critical.
Yeah. So let's talk a little bit about glucose management and glucose control, just because of the huge move of Ozempic and Mounjaro and all these GLP-1 agonists.
Mm-hmm.
The first question people are listening, and a lot of our clientele and our target market and our archetypes that we speak into, whether it's corporate or clients or anywhere in the world, often business leaders, they're corporate executives or they're entrepreneurs. So why is glucose management so important?
Well, in a single statement, glucose control and insulin sensitivity are at the heart of high performance and longevity. So, find me a true high performer who's got insulin resistance. Find me a person who's going to live a long time who's got poor glucose management. They don't exist. What I will tell you, speaking to and taking care of a lot of exactly those types of people, is that you'll find high performers often are beginning to have glucose dysregulation, and it's why they're putting on extra pounds. It's why they can't perform the way they did. It's why they're not sleeping as well as they used to. It's why they have the brain fog or the fatigue or the, you know, whatever the symptom is that they're now experiencing or struggling with. We see that all the time. What I think they often don't understand is that they have to keep that dialed in order to continue to perform at a high level. And it's not dissimilar to, maintenance on a car. No one shows up at the mechanic after driving their car for 30,000 miles with no maintenance and says, I don't understand why it smells funny and is making a weird noise. They know why. They didn't do any maintenance. And so one of the key things we check on every patient is we look at a fasting glucose. We look, well, three things actually. We look at a fasting glucose, we look at an A1C, hemoglobin A1C, and we look at a fasting insulin level. Because and that's, we do other labs that are related, DHEA, cortisol, sex steroid hormones, thyroid hormone. We look at all this because we know that if we see problems in glucose regulation, then we are catching them early and we're able to intervene. Because what truly happens, I can't tell you how many times I saw people no one who winds up in the cardiac ICU is not surprised to be there. They're all shocked. I can't believe this is my first heart attack. I just ran a 5K. I thought I was healthy, but I eat well. And that's the reality, is people don't have this insight into what their glucose control actually is because their doctors are not doing the right testing. They're not spending the right time counseling them. They aren't, they're not really taking a solid history. And so finding out what the glucose control really is, looking at the numbers and making decisions based on those things is really the key to maintaining high performance, achieving high performance, and doing it for a long period of time, which is, of course, what, practically speaking, everybody really wants. So
Yeah.
love the
Maybe you can
topic.
just sort of define, glucose dysregulation, insulin resistance, pre-diabetes, and then diabetes, because I know there's a bit of a spectrum. And I know from the
Mm,
research and literature, you can have insulin resistance for 13 years. You go to a normal medical doctor, he checks your fasting glucose, he checks your HbA1c, all good, you think you're
mm-hmm,
fine. And then
mm-hmm.
10 years later, you get type 2 diabetes, and you're like, oh my goodness, I've been checking my glucose for so long. My 3-month glucose has been good, but you've been suffering with insulin resistance. So maybe define those categories as best as you can. Someone's listening out there and saying, oh, no problem. My glucose is good. My HbA1c is good. My fasting insulin might be even good. And that's why we've also been using CGM. I'm off to Seychelles with the YPO group. They're bringing me out there. And I'm putting a CGM on all the forum members, which is really interesting for them to have a look at the whole workshop and retreat to see what's happening with their glucose. So give us some definitions. And then I want to put it through the frame of heavy metals and toxicity, as well as balancing minerals, being a real cause why people do not have glucose control.
Yeah, absolutely. Okay. So, yeah, first of all, there is a tremendous amount of discordance between all these different labs. So, let me explain what I mean by that. You'll get people who have white coat hyperglycemia. What that means is that they get really anxious around a blood draw and they happen to have a blood glucose that's fasting that's 120. And maybe they don't actually have a glucose problem. They're just anxious because they're having their blood drawn. Other people will have that value of 120 and they genuinely do have some glucose intolerance or hyperglycemia. You'll have other people who've got an A1C that shows that it's borderline high or high, even though they've got a normal glucose or they've got a low fasting insulin. I mean, at the end of the day, I always tell my patients and my staff, we're either treating a number or we're treating a sign or a symptom. And this gets into really what our goals are in the practice, because the thing is, let's say that we find an abnormality in their fasting insulin, their fasting glucose, their fasting A1C. I find that we actually have to be asking questions about what's their goal before we can really know what to do with those numbers. And let me give people a very concrete example. Now, we recently had an A1C came back in the practice in a pregnant woman that was 4.7, which is incredibly low. And this is a woman who was describing ups and downs in glucose control. She was feeling faint, brain fogged, fatigued. And she needed the message of, you need to eat more and more times a day because you are growing another human. You need a lot of fuel to go into the gas tank. And you're clearly running at a low glucose all the time because your A1C is only 4.7. That's incredibly low. Now, at the same time, if you have somebody who's trying to put on muscle mass and their hemoglobin A1C is a 4.7, that person's not going to be able to put on muscle mass because they don't have enough insulin around in order to trigger muscle mass growth. We had a young lady who came in who had an IGF-1 level that was very, very low. And IGF-1, when I see a low IGF-1, I think not eating enough protein or calories in general, but particularly protein, not getting good sleep, or having way too much stress. She's retired, not very much stress. She sleeps very well. What does she not do? She does not eat enough protein. So it's really process of elimination to figure all of that out. But she is someone who needs to eat more protein, maybe even more carbohydrates, if she's going to have the energy that she needs. But she doesn't also have a A1C problem or a glucose problem. And so what she really needs to do is just increase that protein in order to have more energy. So having these conversations with patients about goals before you just dive into recommendations about their labs, I find to be very important. What you'll find, as I was saying, is that you'll have these people who've got, say, normal glucoses, but then they've got a high A1C, or they've got a normal A1C and a normal glucose, but then they've got a high fasting insulin. And really it comes down to, well, what are we going to do for this person in order to try and normalize this number? Because if you're not treating symptoms or signs, you're treating numbers. That's how I view things. I don't know how else you can treat a patient. If you're treating the numbers, usually what I'm looking for is, what does this number mean about their long-term health? A high fasting insulin is not compatible in my book with longevity. A high hemoglobin A1C is going to set you up for a shorter lifespan. But at the same time, we have to be asking questions like, well, why is it actually high? We've got a number of patients who we've seen in the practice who have a high A1C who are on a very carb-restricted diet, which obviously plays into the topic you mentioned earlier, which is heavy metals, toxicity, total toxic burden, stress, things like that. But it's important for people to know at the end of the day that you can have these very discordant results. You can have, and that's why I check all of them. Many people would say, well, we just need to check a fasting glucose. We just need to use a CGM. We just need to use an A1C. I just found, having tested enough people, that it might only be 1 in 100, or it might be 1 in 20, or it might be 1 in 10, but there's enough people out there who've got a problem in those labs that are not being checked, that you lose something in the quality of their care when you don't check those things. And it's all about dialing them in so that they have optimal longevity, so long as that's their goal. And that's where we have to talk about, as I was saying before, where are you and what are your goals? We might actually not carb restrict, and we might not actually worry too much about a high normal A1C in someone who, say, wants to gain muscle mass, because we may actually hurt their gains if we carb restrict in order to try and drive that A1C down.
Cool, but let's take it through, say, someone who's not an athlete or who's pregnant, because people listening to this are corporate executives, mainly business leaders, entrepreneurs, obviously high distress level, and trying to manage that stress, often children, and then these high pressured occupations. So let's look at that and say, okay, they want to know a bit of a continuum. What is insulin resistance? What is prediabetes? And I had Sami Inkinen from Verta Health on the podcast saying you can reverse type 2 diabetes. So really, really interesting podcast. But let's look at defining those And then just look at someone who just wants to really perform well cognitively at work, who's looking at, general longevity and health span especially, and then putting it through the frame of heavy tissue mineral analysis, as well as the detox, as well as the balancing of the minerals. Because I think that's important for people to firstly understand what we're talking about.
Here's what I see happening for the most part with, the archetype or the population that you just mentioned. Oftentimes they pay very close attention to their diet. They're not making what I would call big dietary mistakes. They're not drinking lots of soda or eating tons of fruit or having tons of cookies and junk food. And obviously, all of those things will gradually worsen your glucose control, make you more insulin resistant, and lead you to a higher A1C, glucose dysregulation, hyperglycemia, metabolic syndrome, diabetes, et cetera, et cetera. So we have to tackle all of that first. And I do find that there's a number of those folks who, despite being highly educated and having, for all intents and purposes, every available resource, still have a lot of bad habits that we have to work on. And accountability is key for that. So long as we've got the diet in a good place, then you will find that the A1C tends to creep up, particularly over time. That's sort of part and parcel of aging. And then the question becomes, well, why is it doing that? One of the cases that really opened my eyes to this was a young entrepreneur. Well, I say young. I'm a general internist, so I take care of people who are over 18, and most of my patients are like probably 40 to 75. She came to me when she must have been about 50s, maybe late 40s, and she had horrible glucose control, glucose in the 200s, and she was eating something like 30 grams of carbs a day, which doesn't make a lot of sense. And this is actually the kind of case that I would like to pick the brain of a guy like Erickman or Jason Fung, the guys who are really out there on the cutting edge of low carb diets and intermittent fasting, because restricted, she still had this hyperglycemia. And it led me to ask deeper questions about what was going on. And so I finally did a hair tissue mineral analysis, and lo and behold, she had very high levels of nickel. And it's been a couple of years now at least, so I can't recall exactly what else she had, but she had abnormal levels of metals in her hair. She's been lost to follow up at my practice. I don't know what happened to her, where she went, or what the resolution of her case was, but it was eye-opening to me that this total toxic burden in this woman who eats a very carb-restricted diet must have been dysregulating her glucose despite her best efforts to control it. After a little bit more digging in the case, it became apparent to me that she was running a business where, she constantly had it was a clothing boutique, and she constantly had new stock in, and there was a very strong chemical smell to a lot of her product. And I surmised that maybe the chemicals she was exposed to chronically over decades of running this shop with relatively poor ventilation, because we talked about that. Ventilation can be the answer to a polluted indoor air environment. Maybe that was what caused her to have this total toxic burden that was causing such severe glucose dysregulation. And we see this all the time. We'll see high aluminum levels, high mercury levels, high levels of pretty much every metal in the hair of people in that group, high performers, high achievers who are aging and don't understand why they're now having these problems with insulin resistance. So that is one of the key things that we see happening to them. And it's one of the key things we help them correct, because many of them, if not the vast majority of them, have already tried keto, have already tried low carb of some kind, have already gone maybe even carnivore, and they don't understand why they did all that and they still weren't able to get the A1C down.
Brilliant. Now let's look at diagnosing sort of heavy metals, what you do. And I had Morley Robbins on the show, and looking at copper, magnesium, and ferritin. Do you lose blood work? And we use
Yes.
HMA, but then we've got to send it to the
Mm-hmm.
US. It gets expensive. Some people can't do that. So sometimes
Mm-hmm.
it's a financial restriction. So we just do the blood work. Do you see value in looking? And we've seen a lot of high copper in the African population here in South Africa. Obviously, looking at the relationship between magnesium, getting that RBC magnesium, that red blood cell magnesium up
Yes.
as best as we can, making sure that we get ferritin at a good level. I would love to know your ideal, and I know it's got to do with the patient and their goals. I understand that, but there's such a discrepancy between these ferritin levels. When the normal iron profile is good, As some people say 150 for men, and I've been driving mine down to 60 and 80 between my patients, females and males, maybe 50 sometimes for the females.
Yes.
I find that's made a big difference. But everybody's, Morley says at 20, and then you got Joe McCullough with his own understanding of ferritin, where it's at. So
Yeah.
maybe just put us through how you diagnose heavy metal sort of toxicity. Number one, the value in serum and blood, copper, zinc, and ferritin, and how you balance these minerals with regards to people that are really struggling with glucose management and glucose control, because they start blaming themselves and saying, oh, well, it must be me, I'm doing something wrong, when their diet is often pretty tight and their carbohydrates are low. So maybe give us your sort of process.
First, I want to start with the framework, because I think that understanding the basic foundational principles by which the body incorporates and handles and traffics minerals is really important. And that really starts with the story that minerals are the spark plugs of life. In relative terms, you've only got, say, 18 grams of magnesium in your body. And those 18 grams are distributed throughout the entire body, and they could fit in the palm of your hand. And when you think about the fact that a super low magnesium state is diabetes, cancer, strokes, heart attacks, anxiety, depression, and an optimal magnesium state is, practically speaking, optimal health, obviously, along with the other critical elements of life. There's a world of difference, right, between having a total body magnesium, let's say, of 12 or 5, and an optimal body magnesium of something like, say, 18. And I'm not sure that we can say confidently what optimal levels are in the total body. That's one hole in the literature, I feel, that should be filled by probably autopsy reports. But be that as it may, you've got to understand that when minerals come into the body is going to try and use them to generate energy. But they have to be present in the right proportions relative to one another in order for them to work together. Because as the minerals become bigger and bigger, iron, copper, manganese, molybdenum, let alone the heavy metals, mercury, lead, arsenic, cadmium, they become more and more reactive, more and more volatile. And that means that they are going to put off more and more free radicals. So when you look at the bulk of the oxidative stress that's made in the human body, it really comes from iron, because there's 3 to 5 grams of iron in the average human being. Now, what that means, right, is that the guy with 5 grams of iron is going to be producing, like almost twice as much oxidative stress as the person with 3. But the key there is understanding that the other minerals fit into this because they can mitigate that oxidative stress. They can control that iron. And the minerals, I think of them as fitting together very much like bricks in the wall of a building, or maybe stones in an archway. If one of them is out of alignment, or is in a deficiency state, or is in excess, the whole arch can collapse. And if they're all there together, the arch can support an enormous amount of weight, i.e. stress, metabolic stress, psychosocial stress, emotional stress, whatever kind of stress you want to call it. And that's a really important concept, because that means that finding out what the proportions of these minerals are in the body is really critical. And then making sure that the body's got the right energy to incorporate them in the proper way, which is what I view light therapy is all about, and mitigating EMF, optimizing your daily routine, your circadian rhythms. All that is about getting the right energy to get those minerals into the right places so that they can do their work. So where I come down on the whole, is there value in blood labs? Absolutely. Is there value in hair testing? Absolutely. The big, $1 million question is, what is someone's total body level of these things? And then can the body handle more of any given mineral? So I'll give you an example. I view the blood as being sort of the body's checking account, because it can fluctuate rapidly, but it's also the last place to run out. And that makes sense, because the blood's got to be supplying all the organs. And what you'll see is that people who've got, say, a low red blood cell magnesium may have a normal serum magnesium. They're actually better correlated than I think many people realize, but there's still this difference between the RBC mag and the serum mag. And that's a reflection of what's going into cells and what's going into, or rather is found in, the serum. So what that means is that if I see somebody who's got a high serum copper, which we see all the time, that is someone who cannot accommodate or handle more copper in the diet than is coming in. they may often improve when you actually restrict copper, because even if you're driving it in, it's not being incorporated properly. There's another question here that has to be asked, which is, does the form of the mineral matter? Because we're not getting that information back when we run an assay, right? For example, we spray something like 70 milligrams of copper per day per person in the world on our crops. It's an organic pesticide. So we'll see these very high copper levels in the hair and in the blood of many of our sickest patients. Is that copper usable by the body the way that copper from, say, grass-fed beef liver is? That's a question that I think is open. But in the end, I don't want to be giving people minerals that they have excess of in the blood as a rule. And I also want to be trying to do something to normalize those levels. Because what you'll find clearly in the literature is when serum levels of copper are high, it's creating a lot of oxidative stress. And the people I have who've got the highest copper levels are always the sickest patients. They require the most work to get back to health. They have the worst biomarkers. They have the most difficult clinical course. And time and again, as their serum copper normalizes, they feel and function better, and their other lab work starts to come into line. That's where people going on to high copper diets without a respect or understanding of where their serum copper is, I'm very wary of that. That's where like blindly recommending beef liver to people really rubs me the wrong way. I've had people come in and say, I went on a high copper diet and it really screwed me up. And only when I did something like, say, a high zinc protocol did I get my health back. That's where the hair comes in, because the hair is a really fascinating way of looking at the body. Looking at the blood as sort of the checking account, it can tell you, oh, this person's low in copper. Well, you better give them some copper, or at least figure out why it's low. This person's high. Maybe we don't give them the cashew nuts and the beef liver and so on and so forth. But the vast majority of people are going to be somewhere within the range of normal or low normal. And yeah, you want to give them a more nutrient mineral dense diet, which can help with that. But what I've found is that what you see in the hair is more reliable for making decisions about supplementation that really truly move the needle. So we do hair testing because the hair is really a tissue that's expressed from the body. It is in a very real sense an expression of your overall body's health. And people know this, right? People who are young and healthy and have vitality, their hair, their skin, their nails, it looks great. As they get sicker and sicker and sicker, as their nutritional status deteriorates, as their gut health gets worse, their hair, their skin, their nails, they become more brittle. They lose their luster. They lose their natural strength, and their vitality literally washes out. And that's the change in the mineral status of the hair. Now, hair deposition of minerals is really dependent upon hormones and neurotransmitters and the intake from the diet. And that's what a lot of people get wrong about the hair tissue testing. And I'll mention, we have a hair tissue mineral analysis course. It's called Hair Tissue, or HTMA, Hair Tissue Mineral Analysis Secrets. It's run by myself and Clark Engelbert. We train people how to interpret these tests so they really understand what they're going to see in actual real clinical practice. It's an exceptional course. I can't recommend it enough. We have a tremendously happy group of people coming out of that course and into our then HTMA mastermind, where we continue training them to interpret these tests. And the thing about the hair that is not obvious upon first analysis is that all of the minerals work together. So if you give somebody, say, copper, you will raise their hair sodium, and you may also raise their hair calcium. And if you give somebody calcium, you may raise their hair sodium, and you may raise their hair copper. And people don't get that. And so they end up doing what is instinctively what one would do in looking at hair levels, which is saying, oh, well, your copper and your iron and your manganese and your zinc are all low, so let's give you a multivitamin. But that doesn't wind up actually working. And the reality is that when you start to learn all the interrelationships of the minerals as we teach in the course, you start to see who is going to do better with higher doses of zinc or copper or manganese or B vitamins or specific B vitamins or magnesium or calcium, or say organ-based glandulars like thyroid hormone or adrenal hormone. And then when you start to put all that into practice, you'll actually see the hair tissue numbers coming into balance. And more importantly, you will see the heavy metals that that person has accumulated over time start to come out in the hair. So, one of the cases that really woke me up to this was a young lady who came to me. She was already doing all the things. She was a healthcare provider. She was struggling for years with an autoimmune disorder called myasthenia gravis, which is a life-threatening autoimmune disorder. She was in and out of the hospital, on the mechanical ventilator, in the ICU. And finally, a vaccination pushed her over the edge into a really severe state of this illness, and she started to reinvent her health, first with functional nutrition, and then with circadian rhythms and circadian biology. So she went through a lot of the critical diet and lifestyle pieces that we coach people through at the practice as a matter of course, but she still wasn't getting the results that she was looking for in terms of really overcoming her illness. And her main goal, other than staying out of the hospital, was having a baby. So she came to me. We looked at her testing, blood and hair. I said, you have a high burden of retained minerals. We're going to use this protocol based on the hair. And sure enough, 3-4 months later, she was dumping 40 times as much aluminum into her hair as she had been on her first test. And that number came down subsequently. She pushed out more than 3 times as much copper as on her first test. And this again is why I'm wary of people saying, "Oh, well, your copper's low in your hair," or you're a modern human, you must need more copper. I've seen these people detox huge amounts of copper for months or years at a time and feel worlds better on higher dose zinc supplementation protocols. I myself was profoundly impressed by the effects of a high dose zinc protocol in my own case. And sure enough, my hair tissue testing's gotten better. I feel and function better. And Emily, who I was just talking about with myasthenia gravis, she just had her first child in July, and she hasn't been in the hospital with a myasthenia gravis flare for, I think it's over a year and a half now. So that was the power of hair tissue mineral analysis. As I saw it in one of my first cases that I tackled with those sorts of protocols that were based on a deep understanding of the hair that frankly 90% of people out there doing hair tissue mineral analysis do not have. We will have people come into our program who have trained with other people, and we'll ask them, did you get this level of A, mentorship, and B, insight into how these things interact in your other courses? And the answer is generally no. And we often see, and part of why we put the course together was we saw people coming in who'd seen other hair tissue mineral analysis practitioners, and they hadn't gotten results. They hadn't seen success. We looked at the protocols they'd been put on, and we said, it makes sense to us why you didn't see these results. Let's try something different. And sure enough, we have a long string of testimonials from the program now who say that they're very impressed by how powerful what we're teaching is. So
basically, someone could do this HTMA, have a low copper in their hair, then someone says, oh, you need more copper, and in fact, they're not excreting, their copper's too high systemically. That could be a problem. That
bingo.
could cause even more issues in the body.
Yes.
And then the serum copper, is that a good indicator of what's going on just because I'm seeing such high levels of serum copper?
So the way I think about it, and the way we teach it in the course, is essentially that what you'll see is that the worse the state of health of the patient, the more difficult it is generally for the body to get the minerals that are in excess into the hair. So the higher the serum iron, the lower the hair iron. The higher the serum copper, often the lower the hair copper. And it's not necessarily low, but it's what I would call discordant. So you have a serum copper of 170 and you have a hair copper of 2. Whereas in somebody else who's got a copper of 100, they might have a hair copper of 2.4, 2.5. That's more appropriate. So it's why I get the blood levels, because I don't want to be over supplementing someone who's got a high level of copper. But for the vast majority of people, if you use the protocols we teach in the course, you're not going to over supplement them with anything, and you are going to get lasting correction of the levels in the hair. And the rest of it comes down to, things like phlebotomy, as you know, with high levels of iron, which is still very much part of what I do alongside these protocols, as well as, checking blood levels of minerals to make sure that we're actually getting them to the levels that we want them to be.
Brilliant. Maybe talk a little bit about the iron profile and ferritin, where you like to look. And I know, once again, it's the archetype, the patient, the history, but we're just seeing higher
Yes.
and higher levels of ferritin like never before, especially males now, and they don't have hemochromatosis, they don't have any genetic stuff,
Mm.
but they're like in the
Mhm.
700s, 800s.
Yes.
I just seen someone now who's a huge businessman. He's been around 8 specialist physicians. He was sitting in the 800s, and specialist physician looked at it and said, no, no problem. And he's been struggling, I mean, for 10
Yeah.
years with anxiety.
Yeah.
And this man is like an extremely successful business
Yeah.
person. So tell us about your sort of iron profile frame, and especially ferritin, because a lot of people say, oh, no, you're going to go and, donate blood. They're like, oh, my goodness, no one's ever told me this before. I've never donated blood.
Mm.
What's the
Mhm.
story? My medical doctor said, no, I don't need to donate. So possibly give us your sort of process.
Well, number one, I always want to start by treating the patient and not the number. The number I have to take into account, right? But if I've got somebody who, and for people who don't know, when you get florid iron overload, the manifestations are everything from brain fog to anxiety to low testosterone or low sex steroid hormone levels and low adrenal hormone levels and diabetes and changes in the color of your skin, which are related to that. It's sometimes called bronze diabetes, joint pain, glucose intolerance, so high A1C, high fasting glucose, and insulin resistance. And if I've got that clinical picture, oh, and did I forget to mention high blood pressure and heart disease? If I've got that clinical picture in a man, blood donation is something I'm deeply curious about. And I would be shocked. I cannot think of a single case such as that where the ferritin was low. The ferritin in those cases is almost always high. And then it's a question of why is the ferritin high? We had a case where we saw a gentleman with a ferritin of 2000, very, very elevated, but he had a testosterone of 200. He went on testosterone replacement, brought his total testosterone levels up to about 1200, 1500, and his ferritin levels came down well into the normal range. Since then, he's been donating blood every couple of months, as you do oftentimes when you're on testosterone replacement. That varies from man to man, by the way, but there's a certain amount of blood donation that men usually end up doing when they do testosterone replacement. So did he have a low testosterone as a result of high iron that was reducing his testosterone production, or did he have low testosterone production that left ferritin running around out of control because the hormone wasn't there to control it? Because hormones really do control and move minerals. And a lot of that is very murky in the literature because it's extremely, frankly, very, very difficult to study. In some cases, we wind up in these chicken or the egg scenarios where the answer is arguably academic and it's more about, okay, you're in this situation. What are we going to do to get you out of it? Blood donation can be a huge part of that. I've had men, really, truly lives changed by donating blood. Reductions in blood pressure, improvements in metabolism, improvements in their weight and body composition, improvements in their energy, you name it. Not always, but on a case by case basis, it can be life changing. So the higher the ferritin, the more interested I am in blood donation. By the way, that gets tricky in your patients who've got thalassemias because technically they're already anemic. And that's, something we have one thalassemia case in the practice. We're still sort of navigating how to manage that, but it's a small proportion of cases. So I want to reduce the total body iron to minimize the load of oxidative stress. And that's also based on the literature that shows that as you lower your serum ferritin, you lower your risk of death. That's the Copenhagen Heart Study. And also when people donate blood, they have a lower risk of things like stroke, heart attack, and cancer. Now that literature is very small in scale. It's not, huge numbers of people in these very big, robust clinical trials. But here's the reality of it. The downside to blood donation is that sometimes people feel really tired afterwards. And otherwise, that's it. And the upside is you may see a huge improvement in how you feel, how you function, and your longevity, and you're saving someone else's life. So I have a very low threshold to pull the trigger on blood donation. What I am wary of is there are people who you will find who they go for blood donation and for days to weeks afterwards they feel absolutely wiped out. And for those people, I just have a conversation about that possibility. And I try to avoid sending people for blood donation if their ferritin is low and they're already struggling with fatigue. For me, I've seen ferritins fluctuate so widely that I have a pretty broad range for what I consider to be optimal. And I'm more concerned with, well, what are your biomarkers looking like beyond this? For example, A1C, fasting insulin, fasting glucose levels, things like morning urinary pH, things like DHA, sulfate, vitamin D, um, and high sensitivity CRP in particular. And then my goal is just let's get people on a positive trajectory with improvements in these biomarkers, improvements in their form and their function with some combination of what we call mineral balancing, which is really getting the right minerals into this, like I said, blood donation, fundamental diet, lifestyle, behavior change to bring everything back into balance.
All right. Brilliant. So you can't give us a number where I know you say optimal, but you don't really have a number that you're sort of shooting for under 100 or 60 to 80 with ferritin. You don't have anything specific, because I know people are going to listen and then they're going to ask me questions and send me emails on
Yeah,
this.
if you force me to give you a number, I would say, yeah. Yeah. If I had to give you a number optimal, it would be something between 50 and 100. So, what's going on there? I think it's fascinating.
Mm.
And I'm not sure below 50, certainly below 100 in general, because I know a certain proportion of those people are going to come back to me and say, this really took it out of me. And I really, in some respects, am wary of doing it again because of how many days I was sort of put out by it.
Yeah, got you. All right. So if you have to look at this whole process of minerals and copper, the detox pathways that you look at, I mean, I know a lot of people aren't sweating like they used to, the benefit. I saw you had a live
Yes.
with Brian Richards, and, we've had Brian Richards on the show twice, and we're a huge sauna space, provider here in Africa. But what about, just let's maybe talk about sunlight and minerals and in the sort of frame of glucose control and insulin resistance, I find that people are just not detoxing these heavy metals, not sweating enough. And that's why we use a lot of infrared sauna. So possibly just let us know more about that in your practice.
Absolutely. Yeah. So this goes back to really the fundamentals of cellular energy generation, which is that red and infrared light program water to create an exclusion zone around mitochondria, which then gives the cell the energy to kick out toxins, purify itself, and be really metabolically healthy. And what you'll see in people who are doing a lot of sauna, particularly with the sauna space, is that they will tend to eliminate more of these heavy metals. So I mentioned Emily's case earlier, her 40-fold increase in aluminum from 0.39 to 8.57, that took place when she was saunaing 30 or 40 minutes at least twice a week. So I really strongly encourage people who are trying to purify their body to get in the sauna, because I think it's one of the best ways to purify the body of all these toxic chemicals, toxic metals. But the reason is not just that they're eliminating these things in their sweat, it's that they're fundamentally improving their cellular bioenergetics and the ability of the cell to make energy. Because when you give the cell free energy, when you give it the right minerals and B vitamins and methylation equivalents and light frequencies, the cell is naturally going to try to put itself into the best place possible, which means kicking out toxins and bringing in nutrients and building the right structures to use them: proteins, carbohydrates, fatty acids, membranes, all that.
Okay, brilliant. Okay, what about dry blood spot amino analysis? I've been doing that a long time now as well. It's been really beneficial just having a look at people's low arginine, low lysine, and a lot of them are just
Yes,
not getting enough proteins. Do you
agreed.
use this test a lot? And then often people are taking collagen every day, and I did a little reel on that, just hammering collagen, this proline, and hydroxyproline and
Right.
glycine, and then it
Right.
causes an imbalance in these amino acids. And I've seen a huge change in patients, giving them the free aminos and the essential aminos. What are your views there?
So one of the first 5 habits that we start everyone with is to eat a protein at every meal. And we're very picky about these proteins because what often we'll find is that people think they're eating a high protein diet, but they're really eating a high fat, low protein diet. And what I mean by that is if you look at a lot of the yogurts on the shelf, if you look at a lot of the meats in the meat case at the butcher, in the butcher section of the grocery store, they've got they're maybe 30 or 20% protein. And what ends up happening is people combine that with a carb source and they wind up with the perfect macros for satiety and weight gain. And if you want to know what those macros are, they are the macronutrient ratios of milk. Milk is nature's solution to weight gain for all mammals. And it's like 20-25% of calories from protein, and then something like 35 or 40% of calories from fat, and 30 or 35 or 40% from carbs. And sure enough, that is the formula for gaining weight, not necessarily muscle mass, but just weight. When people switch to, and we get everyone pretty much to do this, we get them to switch over to the leaner meats. We get them away from, dairy, which I have nothing against, but, for example, people will come in with the misconception that cheese is a source of protein, but cheese is like 5 to 10% protein on a caloric basis. So if you ate only cheese, you would end up with, practically speaking, protein malnutrition. And that does not make it a high protein food. It's really a high fat food. And cheeses vary. So that's painting with a very broad brush. I realize that. But, when you switch somebody over to lean ground beef, lean cuts of steak, you switch them over to, trimmed meats instead of fatty meats. You give them a little bit of whey protein, or, some kind of like cottage cheese where it's a higher protein dairy. Then you end up seeing their protein intake increase by 10, 20, 30, 40, 50 grams. It wouldn't be uncommon for us to double someone's protein intake in their diet in the practice. And when you do that, a lot of problems go away. Before I spent so much time counseling people on what to eat to optimize their protein status, I was doing a lot of serum protein or amino acid levels, and I found them enormously helpful, just as you have, from the perspective of, where is your arginine, where is your lysine, what's going on with your collagen-based amino acids, or your essential or branch chain or branch chain amino acids. I found it very helpful there, but we ended up having to sort of pick and choose. Our patients can only do so much lab testing, and we only have so much time to sort of health coach them, and so we're really just going to focus on eat more protein, cook with bone broth. And then if someone wants a deeper dive and a deeper level of resolution and more time with the team to cover that, we're happy to order urinary or plasma amino acids. And, you mentioned blood spot, which is a lot more convenient and shelf stable. One of the things we love about the hair, particularly because we work with people as you do internationally, is we have people shipping their hair to our lab from Mallorca and South Africa, and the hair doesn't go bad. And that's a great, advantage to that. Whereas you might struggle to get samples to the lab on time that are blood or urine and have to be frozen for them to be stable. So that's how we end up approaching that in the practice. But it is very powerful, and many people underestimate. And that's one of the benefits of having health coaches. They can really get into how much protein are you actually eating, and are you these proteins or the protein you think you're getting in your diet, are you actually getting protein, or are you getting a lot of fat or carbohydrate, which is often the case?
Brilliant. And what other detox strategies do you have? So do you use like zeolite after the sauna or after sweat, even after exercise? Some people aren't in the sauna. Do you use spirulina? What do you use? Do you use bentonite clay, activated charcoal? What are the things that people that are listening say, okay, I'm not in the sauna. I'm in the sauna 6 days a week. I just cannot
Yeah,
find anything that is so beneficial, that just hits so many different areas of health, wellness, performance. I think
absolutely.
it's fundamentally important. And then in the sauna,
Absolutely.
then out in the sunlight, because we're not getting enough sunlight. So that combination, that 1-2 punch, even if it's 10 minutes in the infrared sauna and 10 minutes outside, it sort of just absolutely upregulates and optimizes that. But what other strategy have you got from, a detox perspective, especially if people are sweating? Because a lot of people go to the gym that are listening, those entrepreneurs, those business leaders, the corporate they're going to the gym. Do they take them afterwards? What do they do with those sort of binders?
So I have something that I call Dr. Stillman's detox powder. I looked at all the greens on the market and I wasn't really satisfied with them for my patients. And that's important to, mention, right? I see people such a broad range and often who are so sick, frankly, that I have to be pretty careful, even with some of the functional foods that are good for people, but they may be too much for some. So I created this detox powder, and we have the recipe for that at our coaching business called Stillman Wellness, which people can join as a member and they can get access to the exact recipe for that. We use bulk ingredients in order to make it. I'd like to co-pack it and ship it myself one day, but we're not there yet. So I use the detox powder because it has a lot of different herbs and botanicals in it that are natural binders and detoxifying agents. We have a supplement that we use in our mineral balancing protocols called GB3, which is a combination of ox bile, pancreatin, and black radish extract that is incredible. Pretty much every month, somebody comes back to me and says, I started taking GB3 and all of a sudden I can tolerate gluten or dairy or something that I wasn't able to tolerate before. And I don't understand what's going on here. And there's a lot of different reasons for that. But one of them is that as you increase bile flow in the body, you actually will increase the elimination of heavy metals and fat soluble toxins, which are at the root cause of all of these or many of these metabolic problems. Uh, and then for the rest of the binders, we're actually pretty wary of using them with nutritional balancing because binders do not discriminate, generally speaking, between good minerals and bad heavy metals. And there's some controversy about that in the literature, like, for example, with zeolite. But we have not been using zeolites. We haven't been using, we've got a couple people who are experimenting with modified citrus pectin and things like that. But we just haven't found that we needed them to get people results. Another thing that we do tend to use when people are detoxing and they might need a binder is sunflower lecithin, which stimulates bile flow, which will also stimulate excretion, but is also full of things like phospholipids. So we love that as a supplement as well. And between those three things, and then the other thing that we'll use is vitamin C because that mops up a lot of the free radical damage from, detox, healing reactions, and heavy metals. We use a very specific form. I actually just recorded a webinar this morning on how we use high dose vitamin C, which people can access through Stillman Wellness as well. And that's how we do it. But we're not using activated charcoal or zeolites or any of the other common binders. Although, like I said, we're open to them. We're just still not sure how to integrate them with what we do.
Cool. Just one question, because I know we're coming to the end of the show now, but your
Yeah.
view, I mean, you've had all these mentors and you've been through functional medicine, integrative
Mm-hmm.
medicine, you're a specialist physician now in terms of internal
Mm-hmm.
medicine, omega-6s and sort of omega-3s, your view there. I mean, there's just so many influences out
Yeah.
there saying the
Oh my
toxic
gosh. Yeah.
increase of omega-6s and so I know the ratio is important. We had Bill Harris on the show who's been studying omega-3s.
Yes.
I've seen countless and countless, must into the thousands of patients who we've just added an omega-3, a quality omega-3. Their hair's improved, their memory's improved, their sleep's
Really.
improved. It's
Yeah.
been phenomenal. But I'm not so sure how damaging the omega-6s are. I think the biggest thing is the index more than the ratio in terms of these omega-3s that are really, really low. And mine was low, and I've seen a big difference in many, many people. People that have had dermatitis, eczema, psoriasis for years, that have been on cortisone and seen dermatologists, and getting that index up has literally been life-changing. People that have seen ophthalmologists with dry eyes, burning eyes, painful eyes from the screens, and they're just not getting any omega-3s in their diets, or they're taking a really poor form of omega-3. What's your view? Because I know you've been through a lot of mentors and a lot of protocols.
They've all talked about it, but no one's actually ever said what you just said, which is that I've seen lives changed by omega 3s and supplementation, which is fascinating. I'd actually love to pick your brain on that. And that is probably because with who I've ended up working with, most people who got to us had already tried omega-3s. And this is something that I find fascinating as a clinician. You know, you're going to be biased by who ends up winding up coming to see you. And for example, I've seen people who came to me and their omega-3 level was actually so high that it was like abnormal, you know? Like, I don't know if you've ever seen an index at like 14 or 13. I mean, these are crazy numbers. So I've sometimes taken those people off of fish oil because it's sort of a intellectual no man's land. What happens when you push omega-3 levels to 2 or 3 times what the Inuit or the Eskimo, have, which is really what our assumptions about the benefits of omega-3s, in my view, are based on. So what I tend to do is try to simplify the clinical picture, which often means reducing the number of supplements, medications, biohacks, and lifestyle changes that people have already made. Not necessarily, but often that's what we end up doing, because there's only so much bandwidth for the system to respond. And we start with the minerals because of what we see happening. I generally try to get people on chia and flax seeds. Have you ever heard of a guy named Brian Peskin?
Yes, I have. I have.
Have you interviewed him?
I haven't. I'd love to have him on the show.
Yeah, I'd love to hear your interview of him, because
Mm.
Brian's theory is that essentially the benefits of omega-3s really come down to the plant-based omega-3s and also the mineral content of those omega-3 rich chia, flax, and walnuts. And so I try to get people on those things, not because it significantly boosts serum EPA, DHA, and omega-3 indexes. It doesn't. You have to consume huge quantities to do that. But they have many other healing values and properties. And one of my curiosities, and Bill Harris is someone I actually want to interview myself on our podcast, which we just started. But I wonder to what degree the benefits of omega-3s are as much about the minerals and vitamins and amino acids that are coming in with the omega-3 rich foods. And I don't have an answer to that, but we try to put people on an omega-3 rich diet with a minimum of omega-6s. And then, of course, as far as we're concerned, industrially produced seed oils are, not really food. So we try not to have people eat them. The number of contaminants they have is shocking. Peskin's book is a real tour de force on how contaminated they are, which I found very eye-opening, and is part of why I like it. And then, will we start supplementing fish oil for people in the future? My jury's out on that. I'd love to learn more, and I'd love to see some clinical success with it. But as you know, when you're doing a lot of things all at once, it's extremely hard to know, well, what's actually working, and what's really doing the heavy lifting in this person's success. I don't know if you've ever done this, but I've one of the best things that I've started to do is that I ask people for testimonials now every quarter. And I always ask them a very specific question, which is, if you had to give credit to everything that we did that was responsible for your success, what gets the credit and why? Is it 20% the supplements we gave you? Is it, 10%, this or that test that we did that showed that maybe you have allergies, or you've got a problem with your arginine level or a toxic metal? Is it the health coaching that we did? Was it the sun? Was it the sauna? And I let them pick and choose what they're giving credit to, but it's fascinating to hear what they give credit to. And one of the great validators of what we do as a combined, comprehensive, holistic approach is that rarely does any one thing that we do get more than 20% of the credit. It's spread out across everything from, I've had people say, well, one conversation with Jim was 20% of my improvement. And I've had people say, oh, the supplements were 99%. I've had people say, I didn't see a big difference with the supplements. It's really been eye-opening and actually very reassuring that I'm on the right track and that we are dialing things in so that we can really, serve our patients in the best way possible.
Sure. Brilliant. That's incredible to get feedback. And that's what I've done. But every 6 months, especially for those that have been in the practice, I've been in practice now 25 years, 26 years at the end of this year. So it's been, quite a journey. But give a message of hope to that sort of archetype, those business leaders and entrepreneurs and corporate executives. We're doing a lot more corporate work and keynotes and corporate programs and getting in and doing workshops, because I find if I can influence business leaders that are very influential, I can change many, many people's lives instead of trying to do it one-on-one, which is great. And
Yes.
I've been a practitioner, but I really want to try and get out there as much as I can. But, I've just seen chronic disease escalate at such a large degree. And I've seen young children, especially here in South Africa, obesity and ADHD and mental
I
ill
know.
health and just all these things. And I've just seen it over the years increase. But just leave a message for people that are listening now, because a lot of people have despair and they're really struggling, just to believe that it's possible to thrive and be healthy.
You have to manage the stories in your head about what's going on. And I mean, one of the key commonalities I hear from people, whether they're coaching, sports teams or athletes or business owners, or we're coaching patients, is you have to control the stories that are going on in your head about reality. And if the story always has to be, we can win, we can rise above, we can overcome. I love the Marine Corps has this slogan. They say, improvise, adapt, and overcome. I love that. And business owners, entrepreneurs, and they're really leaders, and they have to refuse to give in to despair now more than ever. And they have to raise the level of their thinking. Einstein said we cannot solve our problems with the level of thinking that we use to create them. We have to elevate the level of our thinking. And like never before, business owners and leaders have to lead their people to wellness. And it's possible. I see people stepping into this and leaning into this all over the place, because the truth is, I think people have never been more ready for new leadership, ready for new people to fill a void that's being rapidly left by institutions that are out of touch with the needs of day-to-day people. There's a reason why we have business owners, CEOs flying to see us in Florida who could easily get their care in whatever city they live in. It's not that there aren't well-trained physicians and well-equipped hospitals and clinics, it's that those places have lost touch and are not meeting the needs of those people because they don't care to. And there's a massive void, I think, for leadership right now. And that's as much a crisis as it is an opportunity. And we basically coach our patients in that way of thinking every day. You're coming to us saying, well, I don't know how I can get better, or it just feels hopeless. And a lot of the problem with a lot of people who fail to get better is truly that their self-talk is so negative that they're constantly marinating in these negative emotions that create disease in the body, a la, the mind-body connection and the biology of belief, all these foundational texts in mind-body medicine. So business owners, business leaders need to step up and lean into that leadership role. And like you said, you're working with corporations. We are starting to do collaborations like that, and we see a real need for it, and the employees are ready for it. And it's a lot more affordable than having to pay these insane hospital bills we get in the United States when employees get sick and go in. And it's certainly a wise investment. We get a lot of CEOs and successful business owners who they didn't realize that they had high levels of inflammation. They didn't realize they had insulin resistance. No one was telling them this because their medical doctor was just, well, hey, you take a statin and see you next year. And that's not enough. It's not the cutting edge by any means. And we can really deliver much more and much better than that to them.
Brilliant. Well, Leland Stillman, I want to just declare favor and blessing over you again, you, your wife, Michelle, and just your future child. What a privilege to run a kingdom home and to connect with you again. Really interested in this HTMA course, and, learning, you become a lifelong learner when you're a practitioner. And so just really appreciate your courage, your calling. We didn't get into your book, but maybe you just want to give us a plug where people can get your book and where they can connect with you.
Yeah, my book is called Dying to Be Free. It's available on Amazon, and they can connect with me at stillmanmd.com. That's my website. You can apply for consultation there. And then we've got a company called Stillman Wellness, where we do a lot of health coaching. We have a lot of protocols there, and we host our HTMA course there as well if people want to enroll in that and get direct mentorship.
Brilliant. Well, thanks once again, and really just appreciate who you are and look forward to getting on your podcast. I know that Amy set something up for us.
Absolutely. We're really excited to have you on.